Hi, this is Rachel Passig. Today we will be talking about the ghost of child abuse and neglect. The reason that I chose this title is because child abuse is often like a ghost and it follows around and haunts many children for the rest of their lives. So the problem that I chose to discuss during my presentation is that there are several negative long-term effects that follow victims of child abuse and neglect far into their adult lives. These symptoms include, but are not limited to, depression, anxiety disorders, post-traumatic stress disorders, and substance abuse disorders. I really thought this problem was particularly interesting because a lot of times when we think of child abuse and neglect, we think of an image like this, and we often seem to only focus on the pain and the abuse that the children are experiencing right in that moment. But the reality is the pain of the physical and emotional abuse can follow these children far into their adult lives, invisibly like ghosts, and manifests itself mentally and in emotional ways that a lot of times we don't realize. So I'm going to start by looking at several of these long-term effects specifically. So to begin, let's look at an article titled Child Abuse Brain Linked to Depression by Dr. Ruby Scully. And so this study basically links victims of child abuse and neglect to altered brain composition that causes severe depression. So if you can see this little brain diagram up here, this highlighted portion right in the middle is referred to as the insular cortex. And basically the insular cortex plays a large role in mood regulation and emotional awareness. Now this doctor actually found that several victims of child abuse and neglect had a physically smaller insular cortex. And this smaller insular cortex is what plays a role in severe chronic depression that led these children, followed them far into their adulthood. Another long-term effect is shown in another article titled Child Neglect and Onset of Substance Use Disorders Among Welfare-Involved Adolescents. Now this study was a longitudinal study, which is pretty neat because it actually followed victims of child abuse and neglect from their childhood when they were experiencing the abuse through all the way up into their adult lives. And following them in their progress in their adult lives, this study found that the adults who were victim of child abuse and neglect were actually 12% more likely to developing substance abuse disorders. And a third long-term effect we can see in an article titled The Effect of Severe Child Sexual Abuse and Disclosure on Mental Health During Adulthood. This study was a survey that was given to several middle-aged adults about their general mental health. And so what these surveys found was a correlation between individuals who had experienced childhood abuse and neglect and poor mental health state and mental health disorders in their adult lives. More specifically, it found that the younger their child abuse occurred, the younger age that they were, the more severe their mental health problems were in adulthood. The more severely injured they were physically in cases of physical childhood abuse, the more severe their mental health problems in adulthood seemed to be. And the more children who were subject to more recurrent cases of abuse versus isolated events of abuse had more chronic and severe mental health problems. And finally, looking at sexual childhood abuse committed by a biological relative led to more severe mental health problems in adulthood than if it were to be a random predator. Okay, so now I'm going to look at a solution to this problem. So the negative effects of child abuse and neglect can be prevented or significantly decreased or lessened with treatment and therapy that begins immediately after the abuse is identified. So a lot of times what we see is we discover child abuse happening and we can remove these children from the dangerous situation they're in and put them in a more safe environment, but sometimes they don't get the therapy and the rehabilitation that they need, and these children aren't given healthy ways to cope and deal with all of the emotional problems that they're having on the inside, and that's what follows them into adulthood. So this study, Child Physical Abuse Experiences of Combined Treatment for Children and Their Parents, which was a pilot study, actually shows proof of my proposed solution. So basically, this study looked at combined parent and child cognitive behavioral therapy, or CBT, that many of you have probably heard of, among families where physical child abuse had occurred. And this study found that the families that went through and were consistent with the CBT therapy showed dramatically improved mental and behavioral health of both the parents and the children involved. The therapy also significantly decreased symptoms of depression, post-traumatic stress disorder, and conduct disorders in the children victim of the abuse. And then this chart is from the previous study that I just mentioned, and if you can focus in on some of the numbers here, this column shows mean numbers of the children's level of internalizing, externalizing behaviors and trauma symptoms before the treatment, and then over here post-treatment or after the treatment. And basically in every single category, the numbers decrease. So this is just showing a really positive outlook. So again, going along with my solution, I've mentioned a couple specific ways that we can really make this happen. And these are by mandating counseling and therapy for both the children and families involved in abuse. Maybe after court processes dealing with child abuse and neglect, therapy needs to be required. And then even though it is a lot of times, no one's checking up and following up, making sure that these children are completing their therapy. So having child advocates or social workers follow up with victims of child abuse and neglect longer than just a couple months after the abuse is identified to make sure that these children are getting the treatment that they need. So in conclusion, I just want to reiterate again how the mental effects of child abuse and neglect are equally as important as the physical ones. And a lot of times people forget about the turmoil and trauma that the child abuse and neglect has on these children, and that also follows them far into their adulthood. So if we can give these victims of child abuse and neglect a way to cope and handle and understand the things that are happening to them early in the game, then they won't have to struggle with mental disorders and substance abuse later in life, and they'll have a better way to deal with it. Thank you.